When it comes to regulating blood sugars, this is something that I think everyone should focus on because prediabetes and type 2 diabetes are extremely common, especially with modern food consumption. But it's not just about your food. So the interesting thing is some of our habits can also influence our blood sugars. So a lot of the times people are talking about exercise, but the type of exercise does matter. So one thing that came up in clinic this week that is a very common misconception is that the more intense the exercise, the better, especially when it comes to cardio. So this is things like sprint training and HIIT training where you're really, really out of breath and working super duper hard. Now, in some people, that's totally fine and that's great. But for some other people, it spikes their cortisol, their stress hormone. Now, if you already have a cortisol problem, you're way overworked, overstressed, those sort of things, then sometimes that HIIT training actually spikes your blood sugars along with the cortisol, because cortisol will cause blood sugars to increase in the blood. And so you'd only really know this if you had a continuous glucose monitor, but for those of you who are really stressed out and struggling with blood sugars, maybe stick to lower grade cardio where you're walking or light jogging or resistance training. Just something to think about.